Hello everybody, today I'll be talking about malaria. Malaria is a serious and potentially life-threatening disease which is transmitted by the bite of the female Anopheles mosquito. This mosquito typically bites in the night time, and the hot and humid weather of Delhi right now, the rainy season, is a perfect breeding ground for it. So once it bites and transmits the parasite into an individual, then after a particular incubation period, the person will be having the clinical symptoms of the disease. They would include fever, chills and rigors, and in severe cases, the individual can even have yellowish discoloration of the eyes, derangement of the kidney function, alteration in the mental status, decrease in the hemoglobin levels, and so on and so forth. It can be even fatal in a few unfortunate ones. So once an individual presents in the clinician office with the symptoms of fever, chills and rigors, depending on the clinical signs, the clinician will be ordering a battery of tests. Now the list of differentials is pretty long, and it would include the likes of dengue, typhoid, so on and so forth. It's important to remember, however, that even if the initial test turns out to be negative and there is a high chance, a high probability that you have the disease, the physician might even order repeated tests for 2 consecutive days to confidently exclude the condition. Okay. So patients are generally reluctant to get the test repeated. However, that's how it should be. Once the diagnosis is confirmed, then in severe cases, the patient might need hospitalization and treatment with injection and IV medications. In mild and moderate cases, however, we can easily prescribe some oral antimalarials to the patient so that he can be cured of the disease. A few species like the Plasmodium vivax, now they have some dormant forms, some hidden forms which hide in the liver, and they can result in the relapse of the disease on a later date. So it's of paramount importance that such patients get an appropriate course which might even last for 14 days, right, to completely eradicate these dormant forms, right, so that the fever does not recur again. Another important form in the life cycle of the parasite would be the gametocytic phase. Now this gametocyte is the one that is taken up by the mosquito during the next meal, and the mosquito will then transmit the disease to another unaffected individual. So the good news is that unlike common cold or cough, it is not transmitted from person to person. However, the Anopheles mosquito is the culprit here, which is responsible for the transmission. So the disease is so deadly. We have talked about all the complications that it can lead to, and all the bad things that can happen to people. So won't it be a sensible thing to focus on prevention, right? Prevention is better than cure. So prevention, the steps, they are pretty easy, like wear full sleeve clothing and use insecticide sprays, then use insecticide, the skin friendly insecticides on your body, right, to prevent getting bit by the bug, and most importantly, prevent the stagnation of water at your home and in the surroundings. If the source of water is pretty large, then we can sprinkle some oil on it to prevent the breeding of the mosquito. So this was in short about malaria, and I hope it helped you all. Okay. So finally I would just like to add that high grade fever, like the fever which is very high, fever which is not going away, persisting for a number of days, so please go to your clinician and get yourself evaluated in time right? So that you can get the proper treatment at the right time. Okay, so thank you all.